Hi, everyone. My name is Carlin Hoffman, and I'm a senior investigator with Integrity Advantage. And today I wanted to talk about an article that is available on Integrity Advantage's website on inappropriate billing of anesthesia with pain management injections. So what prompted me to speak on this topic was an OIG audit that was recently published that found over $15 million in potentially inappropriate payments for this scheme. So just to give a little context on this scheme, monitored anesthesia care is not typically medically necessary for these joint injections. And so if you're seeing a high percentage of the time, providers are billing anesthesia with their joint injections, that is something that needs to be monitored. And this is actually a scheme that is near and dear to my heart because one of my very first cases as an investigator was these two providers who would rotate, their pain management providers, and they would rotate which one of them was performing the injections and which one of them was performing the monitored anesthesia care. And after we looked at their records, they eventually admitted that they weren't actually sedating the patients. They just thought that the patients would feel more comfortable with two providers in the room. And since they wanted to be paid for their time, they thought it would be okay to have one of them bill for the injection and have the other one bill for the monitored anesthesia care. So that was a super fun case. That's obviously just straight up billing for services not rendered and is not appropriate. So we actually data mined for this in our client's data. And we had one client have their top provider paid for over $3 million for anesthesia that was billed with these spinal pain management injections. And we have a second client who's chosen to take a more proactive approach, and they are putting providers who are engaging in this billing pattern on prepay so that they can make sure that the anesthesia is appropriate before the payment even goes out the door. So I really recommend that you check out the article, do some of the action items recommended in the article, and let me know in the comments if you're seeing these suspect billing patterns in your data as well. And as always, if your organization needs help data mining for this scheme or any other scheme, Integrity Advantage is here to help.